Good day, guys. Good day, guys. I trust everyone is fine. I'm pleased today's presentation is about diabetes mellitus. But please, before the presentation should keep moving, I can't do that without you. So please, I want you to share for other people to get this video in order for them to benefit. And please, the most important thing, I want you guys to subscribe. Please subscribe to my YouTube channel at Dane360 Health TV, so that you can get every message or every presentation, so that you won't be left out. Please subscribe. When we talk of diabetes is a metabolic disease that causes high level of sugar in the blood. Diabetes is a metabolic disease that causes high level of sugar in the blood. When we say something is metabolic or metabolism or metabolize, meaning converting something from one stage to another, meaning it's a metabolic disease that causes high elevation of sugar in the blood. And I said when something is metabolized, when something is to be metabolized, meaning it's converting from one stage to another. Now let's talk of a type of diabetes. We have the type 1 diabetes, then we have the type 2 diabetes, then also have the type 3 diabetes, which is the gestational diabetes. With the type 1 diabetes, there is no insulin production. Insulin is not produced at all. No insulin is produced. But with the type 2 diabetes, one, either the insulin is produced and the body cells cannot make good use of the insulin, or the amount of insulin produced is not enough to act on the insulin, to act on the sugar or the glucose. Let me take it again. One is either the insulin is produced all right, but the body cells cannot make good use of the insulin. Two, or the insulin is produced, but the amount of insulin produced is not enough for it to act on the glucose or sugar in the blood, because you need to have enough insulin to act on the sugar. Sometimes with the insulin can be produced all right, but the body cells cannot make good use of the insulin which is produced. And with the third one, which is the gestational diabetes, that one normally occurs during pregnancy. You know, when one is pregnant, the placenta releases so many hormones, and sometimes there is these hormonal imbalances. So these hormonal imbalances, or the kind of hormones that the placenta normally releases, sometimes inhibits or suppresses the action of the insulin. So when the action of that insulin is bad, it suppresses or is inactive, or it restricts the actions of the insulin cannot do its work. So hence you see there will be a whole lot of sugar, or much more sugar in the blood system. So now let's talk of the possible causes of diabetes. So with the type 1 diabetes, mostly the cause is unknown. Yeah, the cause is unknown. But some literatures also attribute it to autoimmune diseases. Yeah, autoimmune diseases, but the cause is mostly unknown. But with the type 2 diabetes, the possible risk factors are someone who is overweight. Yeah, someone who is overweight, someone who doesn't exercise regularly, or someone who doesn't exercise, the person is inactive. Then we can also talk of someone who has an underlying conditions such as hypertension. Is also prone, or is at risk of getting diabetes. Then you can also check on your diet. Your diet can also be a factor. Taking too much sugar, but sometimes taking of the too much sugar does not have problem to do with the body. The only problem is when the insulin is not produced. That's where you get the problem. So now with the gestational diabetes, with that one, as I said earlier, with that one, even though the person, the insulin is producing all right, but you know, when one is pregnant, the placenta normally produces some hormones, or when there is an imbalance or hormonal imbalances, these hormones normally suppress the action of the insulin. So when the actions of the insulin is being suppressed by the hormones that is being produced by the placenta during pregnancy, it inhibits the action or the work of the what? The insulin to act on the glucose. So when that happens, the person end up getting diabetes. But mostly 90 patients or 90 people after they've getting the diabetes during pregnancy, when they deliver, the diabetes goes away. It's automatic. Then when they deliver, the diabetes goes away. But at least 5 to 10% it continuing to be with them. The diabetes still be with them. But 90% of the patients after they've given birth, the diabetes goes away. But 5 to 10% of the patients after they've delivered, the diabetes still remains. So normally the normal term is as pregnancy induced diabetes. Pregnancy induced diabetes. Now let's talk of the signs and symptoms of diabetes. What should show that one is having diabetes? One, there's increased thirst. You always feel like drinking water. Yes, increase in thirst. And there's extreme hunger. You always feel like eating. Anytime you are hungry, even though there's enough glucose in the body, but the body cannot make use of it because of the insulin. So there's extreme hunger. There is what? Frequent urination. You see, you keep on urinating within a short period of time, you just go and urinate. Within a short period of time, you just go and urinate. And you easily get tired as well. You easily get tired. And there's weight loss too. You easily get tired, weight loss, before you realize you just reduce in weight. You yourself, you'll be surprised. You just reduce in weight all of the sudden. Then yeah, there's tiredness, there's weight loss, there's increased thirst, then there's extreme hunger. Yeah, extreme hunger. And sometimes you normally find a sore or a wound. So when you get injured, the sore or the wound find it difficult to heal. Yeah, the sore or the wound sometimes find it very, very difficult to heal, or it heals slowly. If that wound is supposed to take like 1 week to heal, because of the diabetes, it can take like 3 weeks to 1 month. It heals slowly, or sometimes it does not heal at all. So these are the very basic signs that you should know them. If you have diabetes, you will surely experience all the signs and symptoms I've mentioned. So now let's talk of the complications. With the complications of diabetes, if one has diabetes and he or she does not treat it or does not go for medical treatment, it can lead to heart diseases. There are so many kinds of heart diseases that we can't even explain them here. It can lead to kidney diseases as well. Even in men, some of them, it can even lead to erectile dysfunction. Yes, erectile dysfunction. And it can lead to eye problems. It can even lead to stroke. So when diabetes is left untreated, it can lead to so many conditions. So please, let's take note of it. So now let's talk about the prevention. For the prevention, you make sure you check on your weight, because if you don't check on your weight and you get obese, it can lead you to type 2 diabetes. And you make sure you also exercise, because the more you exercise, the more the cells are able to act on the insulin and pick the glucose into the cells for it to give you energy. And if you have any underlying cause, you make sure you treat it. And those with hypertension too, make sure you take your drug as prescribed to prevent diabetes from setting in. Yeah, you take your drugs and make sure diabetes should not set in. And if possible, you walk to the nearest health center at least every month or every 3 months to check your sugar level. It's very necessary. You walk to the nearest health center or the nearest hospital to check your sugar level, which is very, very necessary, because you can't see it. Sometimes you can't see with your naked eyes like you have diabetes. Sometimes we base on evidence base to see whether you have it or not. So please, I would like to end this video here, but please, before you leave, please make sure you like, you share for others to also watch and benefit from this useful video. And please try and subscribe for the next video. The next video is going to be on hypertension. So please try and subscribe. Hypertension, another name for hypertension is the silent killer. So please try and subscribe so that you don't miss such video. Thank you very much. I love you all. Thank you.